Good morning. It is Thursday, September 30th. I'm Jessica Lovell. Welcome into the Morning Medical Update. We are here inside the Dolph Simons Family Broadcast Studio. Cancer screenings are at an all-time low. More late-stage cancers are being diagnosed this year as people skipped out on their health screenings due to COVID-19. We're going to hear from our cancer docs on these concerning, lasting effects of that. But first, Dr. Dana Hawkinson, Medical Director of Infection Prevention and Control, joins us with the numbers. Good morning to you. How'd we do overnight?
Yeah, we're doing pretty good. Again, right now we're under 30. That's good. The least amount of people in the hospital because of COVID, the better. We have 28 active infections, 8 in the ICU and 7 on the ventilator, still 34 in that additional, that recovery period. So a total of 62. Again, 28 of those are active. And Hayes has 10 active patients and 5 in that recovery period as well. So again, I think continue, and we hear this every day, please get vaccinated. The goal of the vaccination is to prevent you from coming to the hospital. And we have seen this. Even months out, there is still good efficacy of these vaccines. 80%, 85, 90% of people who come to the hospital are unvaccinated. So please get vaccinated.
The Moderna data looks amazing, right? Even 6 and 8 months out, you still have a really good response, really good efficacy. Pfizer clearly now booster after 6 months for those who are older, immunocompromised. The J&J vaccine looks great. And maybe a 2-shot regimen, and I suspect we're going to come around to, and you and I were talking before the show, the AstraZeneca vaccine published in the U.S., the data looks pretty good too, with fewer side effects they saw across the world. So, I mean, I think the answer is going to be go get a shot. And also some important data, Hawk, about being pregnant. And I think, it's an interesting conundrum, though. The CDC is saying if you are thinking about getting pregnant, if you are pregnant, if you've just been pregnant, go get vaccinated because the risks are so high in pregnant women about bad outcomes related to COVID-19. And we've seen some of those. The patient who's been the longest year on ECMO is postpartum, and that's a big struggle. So, what I really wish is that the FDA would come around and change their product labeling, because let's be honest, the product labeling for the Pfizer vaccine, so there's not enough evidence to say if it's safe or not in pregnancy. And that's a bad labeling right now. I think the data is becoming very clear that A, vaccination is safe in pregnancy, B, pregnant women don't do well with COVID-19, C, pregnant women need to get vaccinated, Hawk.
Yeah, absolutely. And this goes with what we say. I was going to talk about our experience here, exactly what you said. We have seen some sick people, and especially that one that you have seen, but we have seen some people in the ICU who haven't made it through as well. The risk of admission is symptomatic 2 times higher when you have COVID if you're pregnant going to the hospital.
And these are otherwise young, healthy people, right? I mean, this is not like the sickest population in the world.
Correct.
So clearly pregnancy can be an immunocompromising illness, and we know the same thing's true in influenza. If you're pregnant, you need to be vaccinated with influenza. Bad outcomes if you're not.
Yep, and 70% increased risk of death as well. So please, if you're thinking about getting pregnant, if you are pregnant, go get vaccinated. If your physician or medical care team is telling you not to get vaccinated, it may be time to seek out a second opinion. We certainly have referrals here. We have plenty of our physicians. We've heard Dr. Weinecke on our show.
We've heard Dr. Alt on our show
as well. So please, really get vaccinated. If you want to do the best thing to protect yourself and your baby from the impact of COVID-19, get vaccinated. If you don't care so much about the impact of infection to either you or your baby, then don't get vaccinated. But just understand your risk of adverse outcomes, your risk of death is significantly increased.
Yeah, the CDC put out an emergency health alert about this, and it's just times we need to take a stand about that. And I think clearly being vaccinated while pregnant is a public health issue.
So how rare is that, though, for them to put out an emergency alert? I mean, I think, 20, was it?
Yeah, not very often until the COVID.
That's the problem. This is
alerts,
a little bit.
Right? Because as soon as the CDC gets really important new evidence, they push it out so that the public gets the information. And so there have been more of those now than we're used to seeing. But we see them a lot more now because there's a lot more developing news around COVID-19.
Do we have some reporters on the line? Let's get to those.
Hey, good morning. Cody Holyoke with Channel 9.
Hey, Cody.
Hey, you talked a little bit about the pregnancy issue. The CDC out with this urgent alert And I know that you've said that there are patients in the health system that you've seen this. I've read a number of articles saying southern states are really being hammered by this. How serious of an issue is this right now?
Pregnancy and COVID, I think it's a very serious issue. I think if Dr. Weideke was here right now, she would be able to detail it better than I can, and we should make sure we get these two connected because she'll do a great job of outlining it. And even here in the health system, right? Let's be honest, we've had resistance among young women who are afraid of being vaccinated, and I think a couple of our folks with Dr. Weideke and some others have done a great job of talking with folks about the risks of vaccination versus the risks of a bad outcome around pregnancy. And I think we just have to keep the conversation going. I don't think anybody wants to do the wrong thing or wants to do a bad thing. I just think they're scared. And they're afraid, okay, I'm going to put this thing in my body. People don't really know yet. They could do something bad to me or my baby. There could be long-term consequences. When you sit down and visit with Dr. Weideke, and you'll come away thinking of a different story, because the reality is that the COVID risks are so high if you're unvaccinated and pregnant that's where the bad outcomes happen. It's not just going to happen to you and your unborn child. It's going to happen to all the other children you have in your family, all the rest of your family, because your death means everything to them. And so that's the problem. That's why that's what's an emergency health alert.
Yeah, absolutely. And I think the other thing that we have to deal with, and we have been dealing with since the beginning of the pandemic, is the misinformation campaigns. And there's coordinated misinformation campaigns. There's uncoordinated misinformation campaigns, a lot of these coming from social media. I think it's very dangerous to get a lot of your medical advice from social media, but I think we have to take that into account as well. It's a lot easier to go to your Instagram account, TikTok, or Facebook, rather than seek these out in these verified sources such as the CDC, the FDA, and what have you as well.
Here we go. TikTok, news, the CDC. Is there really a question here? Right? Is there really a question? If you look at what the CDC's done, they have become so transparent as rapidly as possible and pushed all the information out there. Made up news network, I don't think they're transparent. I don't think they're honest, and they are most certainly not scientific.
Other questions?
Right. Don't listen to your uncle on Facebook. Got it.
Yeah, I think that's right.
Yeah. Let's talk more encouraging news. We here at KMBC9 are tracking the testing positivity rates in both our states. We've been doing that for a long time. We're seeing, I believe, 9-week lows for Missouri right now, lower rates in Kansas. Are you encouraged by this? And what does this tell us?
It tells us that masking and vaccination work. And the biggest fear we have right now is that if people start taking off their masks, we can easily see a rise, especially in schools and other places. So I would really encourage our politically elected leaders to keep masks on in our public places, and especially indoors. Outdoors, do what you want, I think is kind of what the story is. But in the indoors, maybe not totally do what you want, but in the indoors arena, you really need to be masked as much as possible. The other thing I would just say is A, vaccination works, and B, we've had a lot of the people now, Cody, who exhibit at-risk behavior. That is, they're not masked. They don't really follow the COVID. I think a lot of those folks have had COVID. Yeah. And so I think there's a little bit of immunity taking place in the people who have the riskiest behaviors. Mm-hmm. And so I think that's probably helping us as well. Yeah. And then there's a lot of folks who are vaccinated, not as many as we need.
No, I would certainly agree. And I think to your point, I think it is time. This is an optimal time right now. Of course, every time is. But this is an optimal time now as we see these decrease in case rates. Will there be another surge? I think we have to anticipate that. Certainly here at the health system, we do anticipate that. But now we are seeing a decrease in case rates. We are starting to see this picture now of also our decreasing hospitalization rates. So it's optimal for those people who are unvaccinated or for those people who have had COVID recently who are unvaccinated to go get vaccinated so that we can build up that immunity, because we know it takes that time. It takes a couple weeks after that first dose, and then you have to get your second dose as well. We know that if you get vaccinated, that is more optimal than just having natural infection with COVID. You are able to increase and boost that breadth of T cell and B cell responses so that if other variants do arise, and we definitely assume they will, you will have probably a better response to those variants than if you just had natural infection. So again, even if you've had COVID-19, especially if it was mild illness, it is incumbent upon you, it is so imperative to go get vaccinated. And again, like we said, get any one of the 3 vaccines that are available now. Just get one of them at least. It's very important to do.
Can we just say this, Cody? Fool me once, shame on you.
Yeah.
Fool me twice, shame on me. Things get better. We take masks off. People start going indoors as the cold weather comes. It's going to be raining and wet the next few days, and you can see the cool weather coming in. Schools start getting together. They take masks off. After school activities. Do we think we'll see another wave, Hawkeye? I would bet on another wave.
You know, I
We're
would
not
think
going to get
so.
fooled by that.
And we also have seen now more and more stories coming out about supply chain. And the auto industry is worse than we thought it was. Well, we have auto plants here. The supply chain is worse than we thought it was. So, you know, we always have concern out west and nearby. We have the food processing plants. It's imperative for all of these important workers, these essential workers, to keep our supply chains up, to get vaccinated, to stay healthy so that we can keep production going, keep people on jobs, and keep getting back to some sort of semblance of life like we used to know in 2019 as compared to 2020 and 2021.
Other questions?
Thank you.
Anyone else on the line? I do have a question from Taylor from Cake in Wichita. So he is saying we are seeing school COVID cases decrease for staff and students for the past several weeks. What are your thoughts on that? Any reason why that would be going down?
I think that kids are. I think that masks work, right?
Right.
That's what we know. Masking works. We prove it every day in the hospital, but we don't make everybody sick. And with our medical staff, and our hospital staff, our nursing staff, who, by the way, just got their 4th magnet designation yesterday. Can we just call that out? I wore green for that today, and that's a very big deal. Not very many people get 4 magnet designations, and we included all of our ambulatory practices this time. This is a really big deal. So hats off to a lot of good folks who have helped make that work. Rachel Pepper, our chief nursing officer. As you step back and you look at what happens in schools, is I think people who exhibit at-risk behavior may have already been sick. B, some people are already vaccinated. C, masking works. Keep masks on. I think if you take masks off, those positivity rates will start to increase again.
Yeah.
Is that it for reporters today? All right, so we'll get to our community questions here in just a moment. Let's turn to our guests, though. Joining us here in studio, of course, Dr. Stites and Dr. Roy Jensen. He is the Vice Chancellor and Director of the University of Kansas Cancer Center. How are you?
Good morning.
Good morning. Good to see you. And there he is, Dr. Ronald Chen, Chair of Radiation Oncology. How are you, Dr. Chen?
Good morning. I'm good, thanks.
Good to see you. Good to see you both. So I have a few questions, Dr. Stites, for them. But jump in here when you've got
Yeah, I
some
will,
too.
because these are 2 of my favorite people on the campus.
Right?
Roy Jensen and I go back approximately a very long time, because he's really an old man and I'm not. But what a remarkable job this guy's done in our cancer program.
Approximately a very long time.
Yeah. It has been approximately a very long time, right? It has.
Yes.
All right. So we know that our cancer patients are at an increased risk of getting COVID. We talk about that all the time. So, Dr. Jensen, I'm going to just start with you. What is your biggest concern as vaccination rates aren't where we thought they would be and should be at this point in time?
Sure. I think my biggest concern is for cancer patients that have clearly compromised immune systems, like our hematologic malignancy patients, our patients in active treatment. The fewer people out in the community that have this virus, the less likely it is that they're going to get infected, either through a breakthrough infection or some other circumstance. And their immune systems are not normal, and so they have a very tough time if they get a case of COVID, and it's entirely preventable, and we need to do everything we can to protect them.
Dr. Chen, your concerns right now.
Well, I think the message that Dr. Stites and Hawkeye and everybody has been talking about is get vaccinated. I mean, I think my concern is not only the cancer patients with compromised immune systems. We know cancer patients are also more likely to not only catch COVID, but be more likely to have severe complications from COVID. So I think the issue is not just the cancer patients getting vaccinated, but people around them. If people in our community, if you have family or friends or close ones that have had cancer or have cancer right now, you need to get vaccinated to protect not only yourself, but also your loved ones as well. I think that's really, really important.
Dr. Chen, I want to ask you about some disappointing research that was out there, and you and I were going back and forth yesterday, and I wanted you to kind of explain it, but cancer screenings were starting to go back up in 2020, and then that stopped, and now routine screening procedures for breast cancer, colon cancer, cervical cancers, they fell by about a third in 2021. So can you tell me a little bit about the reasoning behind that drop?
Yeah, and just to sort of talk a little bit about the data. So yesterday, Dr. Jensen and his bench to bedside actually interviewed the NCI director, Dr. Sharpless, and talked about some of the research we led here at KU Cancer Center looking at these issues. So a few months ago, we published data that showed that the COVID pandemic has led to a significant drop in cancer screenings around the U.S. And I think our estimate was that in 2020, because of the COVID pandemic, cancer screening was down, or a deficit of almost 10 million. So almost 10 million cancer screenings were missed because of the COVID, because of missed appointments, because of hospitals being closed, appointments being canceled. What we did see toward the end of 2020 was that screening rates were picking back up. So on a monthly basis, if we compare 2020 to 2019, on a monthly basis, the monthly screening rates were coming back up across the country. But in order to make up for 10 million missed screenings, the return of screening needs to be back above baseline levels. It has to be significantly above for us to catch up on all the missed screenings that happened in 2020. And we don't see that. And there's some recent data that looked into 2021, the early months of 2021, and showed that the return in screening is still not at the rates that it needs to be to catch up for the missed screenings in 2020. So that's very concerning, because missed screenings means that when cancers are diagnosed, they'll be more advanced. And when they're more advanced, they'll be less likely to be cured. So this is really a major problem.
Dr. Jensen, anything to add to that?
Yeah, I think both Dr. Chen's study and Dr. Sharpless's study out of the NCI has clearly shown that this is a major health issue, and as many as 10,000 deaths over the next 10 years could result from this deficit. And we've got to figure out a way to not only get back up to normal, and by the way, normal is probably not good enough just in the typical situation, but we've actually got to make up this deficit. Because patients that are diagnosed with cancer at later stages don't do as well and don't have as good a chance of survival.
And that 10,000 deaths is with breast and colorectal. And I remember that 10,000 was that estimate that we talked about early on in the pandemic. Mm-hmm. And so that was so early on, and now here we are, and we're like right on point with those estimates. That's very concerning.
That's
How
right.
do we turn that around?
Yeah, and I think you make a very good point. That's just from the three major cancers. Mm-hmm. We're not talking about all the other types of cancers, because it's hard to get good data. Because the numbers are just a difficult issue there. But so it's likely to be many more than 10,000 when you account for all types of cancer.
Dr. Chen, what are some of the other cancers you think are going to be most at risk by not getting screened?
Oh, I think so. The common cancers we think about for screening are, of course, breast cancer, colon cancer, and prostate cancer. I think another one that's really important to emphasize is lung cancer. Lung cancer is a type of cancer that can actually grow rapidly. And so if we miss screening for 6 months or a year, that could actually dramatically change the stage of that cancer. So I would add lung cancer as another point of emphasis for this discussion.
Yeah. I lost my mom to lung cancer when I was a very young man. I could not agree with you more. And as a lung doctor, I would just say to all those patients out there with a smoking history, go talk to your primary care doctor. Figure out if you need to be within the category of folks getting screened. Don't miss that opportunity, and don't fall into this trap of being so afraid, because you guys have kept the cancer center safe, along with Dr. Sue, and Jeff Ride and Wade, Dr. Sun, and everybody, the whole team of folks down there, working to keep our patients safe when they come in from COVID-19.
Yeah, I think that's absolutely true, Steve. In fact, I would say one of the good news stories coming out of this whole COVID epidemic is that we have the tools available to make sure that it is not transmitted in a healthcare setting. And we do a fantastic job of making sure that it isn't transmitted.
Hey, you do a great job, and I'll just say, and Hawkeye will know this, I think we have maybe one documented case of a patient getting COVID-19 in the hospital where we know it's much more likely. We have 0 in the outpatient side, 0 in the cancer center. You may get COVID when you go to the grocery store. You're not going to get it at our cancer program. Go get screened.
So we talked about some bad news as far as the numbers. What are the challenges, and then tell us what some of the good points are and where we're heading and how we get there.
Yeah. You know, I think in terms of COVID and cancer, it's the same issues of we've got to get more people vaccinated, and we've got to decrease the incidence of this disease in the community so we lessen the chance for our immunocompromised patients to be susceptible to this disease, because they do not do well. And you know, if you want to get somebody who's really adamant about this, just get Joel McGurk and his data from his heme malignancy patients. They have a very compromised immune system, and COVID really ravages that particular group of our patients.
In fact, that's a population that should get 3 shots, it looks like, with the Pfizer vaccine or with the Moderna vaccine.
Yeah, I mean, I would say Dr. McGurk is probably one of the strongest patient advocates I've ever worked with.
Yeah.
He has a passion for doing the right thing. I mean, we all do, but he is kind of over and above.
Yeah, he's
we
great.
see that every time he's on the show.
If I got sick like that, I'd want that guy.
Yep.
That whole team.
So before we get to community questions, and unless you have some, I have one last question, because this year marks the 50 years of cancer research. I want to know, Dr. Jensen and Dr. Chen, just your hope for the future as far as cancer treatments are concerned, and what do people fighting it now, fighting it down the road, have to look forward to as far as good treatments available?
Yeah. Well, we talked about this yesterday with Dr. Sharpless, who's the director of the NCI, and you know, in many ways, this is one of the most exciting times to ever be a cancer clinician or cancer researcher, because we have so many tools available, and we're making progress against a really broad number of fronts. And you know, primarily, I would say understanding how to use the immune system to fight cancer, and then understanding cancer at a truly molecular level that enables us to design therapies that are specifically tailored for patients' individual molecular alterations in their tumor. And I think both of those tactics are going to be critical to making progress against this disease over the next few years.
You and I grew up in medicine, Roy. It was about chemotherapy, radiation, and maybe we could extend somebody's life by 6 weeks. Is chemotherapy done?
Well, you know, there was a great article in the New York Times.
I know. I just making that reference. That's what I was coming to bring it up.
And we're starting to see the elimination of chemotherapy in a number of very important cancers, and you know, breast cancer is a superb example, because we have good data that when we do molecular testing, we can identify those tumors that are likely to benefit from chemotherapy and those tumors that are likely to not benefit for chemotherapy. And those are both critically important questions. And there's no reason to undergo, you know, all of the side effects of chemotherapy if ultimately you're not going to benefit. And so being able to understand which patients fall in which categories is, I think, going to be a critically important question in the near term for our cancer patients.
And can I just say with Dr. Chen, you know, radiation therapy had this bad name, but your story has changed so remarkably in the last few years, and this spring it's going to change even more so. Can you talk about that?
Yeah, very, very exciting. So just as chemotherapy or systemic therapy is changing, radiation therapy is changing too. I think the big news here in Kansas is that we are bringing proton therapy to this area. Proton therapy is a very advanced form of radiation. It can target the tumor and reduce side effects. And there's only 38 in the country, and we'll be able to bring that here to the Kansas City area in just a few months. The construction is underway. The machine is here. We're testing it. It's almost ready to use. So we'll be able to offer that to patients, and also that will significantly expand the number of clinical trials we're able to do with proton therapy. I'm very excited about that. I think it will actually help us serve even more patients in this area.
That is a really big deal. And can I just say, these guys had another big deal because something else just happened a couple of weeks ago.
Well, we just submitted our competitive renewal application for our P30 grant, which is our Cancer Center Award. And so we were really excited to get that out of the way. And now we're getting ready for our site visit, which will take place sometime this spring. And that will be the final step in the process towards moving towards comprehensive status, we hope.
These guys did a great job. They're rock stars, Jess.
I
They
know
really
that,
are.
and I see every time you mention proton therapy, Dr. Chen lights up.
Yeah, he
So-
does. He does.
Just like proton therapy.
That's what I
like-
was going to say, literally
Halo.
and figuratively.
Literally lights up. So, all right, yes, we love having you all on, and we're already getting some questions from our community, some cancer questions, so we're going to get to those. But this first one is from Jennifer, and it's for Doc Hawk. When Doc Hawk uses the term recovery period in relation to COVID patients, could he explain what defines that period?
Yeah, so this is keeping in line with CDC guidance, and basically it is 10 days after your positive test or your symptom onset if you are not admitted to the ICU or you have severe disease. If you have severe disease, it's any time from that 10 to 20 day period. So we do have people here who unfortunately stay a long time if they are here after that 10 days. And for the most part, we use the 10 days as the day that they test positive just because it's more objective sometimes than when people say their symptoms started. So it's based on that period when you can discontinue transmission-based precautions based on the CDC criteria.
So mostly we're saying you're not shedding the virus and spreading it
Correct.
to others at that point. And so that's an important differential, and we approach that patient care a little bit differently.
Yep.
And of course, you don't have to be an inpatient if you get vaccinated,
Right.
and or you certainly won't be. You're not going to go to the ICU. Yeah. And the second thing is long haul syndrome. We haven't talked about that yet today, so let's put it out there.
Right.
You want to not get long haul syndrome. We know that 30 to 50% of patients will have prolonged symptoms up to 6 months or more after they have the most common things are fatigue and anxiety and shortness of breath and things like that. And those are really important deals. And that vaccination reduces that risk dramatically and the severity dramatically.
Yep, and I would say just to the point of the first question, it's about, mostly it's about just wearing gowns, because all of our providers continue to wear masks, obviously now with the new OSHA requirements, N95 masks, but also eye protection. So really the main issue is the cohorting of the people on certain COVID units, but also lack of needing, not having to use the gowns for those people in that recovery period for the most part. And then of course, and we've seen better data and good data that shows that vaccination also helps reduce that long haul syndrome, because we do know it is quite impactful on people's daily lives now, and just as you said, Steve, a good proportion of those people that do get COVID-19.
Tanya wants to know, do we think numbers are so much lower because more people are getting the shot, or just due to more outdoor activities instead of indoor, or a combo of both?
Yes, and masking. I think the mask mandates, every time we put a mask mandate in place, the numbers have dropped. And we've done it now. This is our fourth time, and every time we do it, it goes down. And I just, that's why it happens. And the Delta variant, that we haven't had that much more vaccination, unfortunately, between when the Delta variant first appeared in May and now. There's more, but not enough to suppress and not enough to bend the curve. What's bent the curve is what's always bending the curve, which is infection control. And so wear a mask.
Yeah, and I agree with you, but we do think, and you touched on this earlier too, that it is part of the infection running through those people that are getting it, whether they're in those high-risk behaviors, but we know people who aren't in high-risk behaviors get it as well. And unfortunately, what that leads to is increased hospitalizations, increased amounts of death, that never should have happened because of this. So that's why it is so vitally important to get vaccinated, so that if you get infected, your risk, even if you're healthy, your risk of going to the hospital is much less and having these adverse outcomes. So we do think it is because mostly, vaccination, but also the infection is kind of run through that population that is either at high risk or who has also gotten it, certainly for this wave and surge. But unfortunately, these infections, although the majority of people won't have to seek hospitalization, we have seen what happens, not just in our hospital, but also around the metro area and really around the nation. People who otherwise should not be in the hospital are going to the hospital because of this infection.
Ashley has an extended family member who was just diagnosed with stage 2 uterine cancer. She says, we don't know the treatment plan yet, but what would you think the holidays should look like for us for getting together? There are still several family members who are not yet vaccinated.
You'd like a little more specifics in terms of the timing of their treatment and all of that. Stage 2 uterine cancer, and I assume they mean endometrial cancer and not cervical, but I'm obviously that's one other thing that I'm not clear about. There's a variety of different treatments available for either one of those diseases. Some are in Ron's realm with radiation treatment. One of the primary treatments, obviously, is surgery, and until they understand the extent of the invasion of that particular cancer, will depend upon what that determines whether or not they get chemotherapy. So chemotherapy would be the major thing which would decrease their immune system's robustness, and so I think that's the key issue when it comes to the holidays.
So it's not just having cancer, it's what
Not just
kind of
having
treatment
cancer,
you're getting.
it's what cancer,
Yeah.
what treatment.
Dr. Chen, what advice would you have?
Yeah, I wanted to sort of just add to what Dr. Jensen said. I think that if the diagnosis is recent, then it's quite possible that when the holidays come around, the patient may still be either in treatment or soon recovery soon after treatment. And so I think the patient is vulnerable to COVID and complications. If it were my family member, I would encourage every family member to get vaccinated to reduce the risks to this cancer patient. And so that would be my advice. That's what I would tell my family.
And I think we would say small group gatherings in your bubble. Don't go outside your bubble. Don't bring people outside your bubble into the thing, and wear a mask, because it's not just COVID. There's a lot of influenza is already more prominent this year than last year. There will still be an RSV season, and probably in the winter we had a summer one, but it's dropped a little. But fully expect that to have a return. So I think if you just think about Hawkeye, I'd say to somebody like that, you just stay in a small group gathering, stay in your bubble, wear your mask. Everybody has to be vaccinated or they shouldn't come around.
Yeah.
Keep that person safe.
Absolutely, and I think this can be generalizable to the entire population. Now, again, we have seen the excess mortality, the excess illness and excess death because of this disease. We have an easily obtain and easy to get preventive measure, and that is vaccination. So again, I think it just goes back to the beginning of the show when we talked about we are at an optimal time now. We can get ahead of this. For those people that aren't vaccinated, think ahead not only to maybe the next surge, but to the holiday season, and encourage those family members or those friends that have not gotten vaccinated to get vaccinated, so that you can all meet and gather in those small groups, just as Dr. Stites had said, with the knowledge that you now are more protected and can keep each other safe.
Deb has a question for our cancer doctors. Will all of the research done with the mRNA vaccine help with cancer research or bring other new therapies?
So that's a really great
question.
Yeah. And mRNA vaccines were really developed out of cancer research, and Dr. Sharp talked a little bit about that yesterday. We're already thinking about ways that we can capitalize on that, and to get a little bit in the weeds, there is discussion about creating an entire new institute at the NIH, which would try to move therapeutic development forward. And one of the projects they're talking about is developing a one-shot vaccine that would be against the 50 most common mutations that we see across the entire spectrum of cancer. And what a game-changing
That's a wow
thing that would be if we could all get vaccinated and dramatically drop cancer incidence rates because our immune system was boosted to prevent those from occurring.
And so, yeah, so if your body saw that gene, that alteration, it would attack those type
That's
of
right.
cancer cells, and that's pretty cool because we all produce funny looking cells, and our body scoops them up. But in cancer cases, sometimes the single cell line grows a little too fast, a little too much. This would be a way to help prevent that.
Absolutely.
That's not bad for a pulmonary guy, was it?
That's right.
Not
That's right.
bad.
We'll give you full credit for that one. Thanks.
Dr. Hawkinson.
I think that's a great question and a great answer by Dr. Jensen. There is a good kind of shorter review of this in nature.com. It was from the September 14th issue, and it goes through the history, and it absolutely started out as a cancer, looking at cancer therapeutics and prevention, but it is a good long history of the mRNA vaccines. So certainly we hope that they can still find use there, but also for that, but also for other infectious diseases as well.
We should also not leave this conversation without noting that KU alumnus, Barney Graham, was the one who really designed the overall strategy for developing these mRNA vaccines.
And stay tuned because we're going to hear more from him
Yep.
here.
Oh.
Very soon.
Very
That's
soon.
right. Is that a rock chalk moment right there?
Right. Chuck.
Not
Rock
bad for a
chalk.
guy with a decision right there. That's
Before
what
we
I'm
get to the
talking
next question, Dr. Chen, did you have anything to add to that?
I do not. Great discussion so far, and also great discussion yesterday with Dr. Sharpless on this topic, so nothing to add.
It sounds like we need a link to the bench to bedside that you did yesterday for a lot of this good
There you go.
information.
Yeah.
I bet we could pop it up here at the end of the broadcast. What do you think?
Let's see if the guys can work their magic. Don't you love when Dr. Stites puts you on?
I love it. Live long and prosper, brothers. That's what I'm saying to you.
All
Thank
right.
you.
Yep, they gave you the sign. Okay, Dr. Chen, you did mention this about lung cancer being one of those cancers screenings that you were concerned about. Several people asking, and Sandy is one of them, how does one get a cancer screening to find out if you have onset lung cancer?
Yeah.
Is that a screening that's possible?
Yes, so, and I'm happy to start, and Dr. Stites can chime in too as a pulmonary doctor, but I think lung cancer screening is recommended for individuals who are high risk, so significant smoking history, for example, and so there's guidelines on which individuals need lung cancer screening, which is usually done with a low-dose CT, which is basically a CT scan that can look through the lung to see if there's any small masses that are seeing, and you want to detect it as early as possible, of course. And that usually happens through the primary care physician. One of the really important things to emphasize is that a lot of cancer screenings, whether it's lung cancer or breast cancer or prostate cancer or skin cancer, colon cancer, really the screening starts with a primary care visit. And it's really important to make sure you see your primary care once a year or more often if that's indicated for your conditions. And so it starts with the primary care doctor. They will order the screening test. And for the right individuals, eligible individuals, they will get the CT scan to screen for lung cancer.
What do you think about people with significant secondhand smoke exposure, Dr. Chen? Is there data around that to tell us whether or not they should have cancer screening done as well?
I'm actually not sure about that. I'm happy to look that up to see if that's a part of the indication.
I knew there was a little controversy around there that some people would recommend, some people not. These guys are smarter than I am in this world, so we'll have to figure that one out. We'll get back.
So, but with lung cancer screenings, is smoking, is it run of the family? How else could you
No,
get?
it's smoking. It's really all
just
about smoking. Yeah,
That's
it's all
it.
about smoking.
Well, about 85% or
Yeah.
so of lung cancers are clearly related to tobacco use. But there is a growing number of lung cancers that have been seen in individuals that have never smoked. And this is particularly true in women and in Asian Americans. And the biology of that type of lung cancer is completely different,
Very different.
from tobacco-derived lung cancer.
Its rate of growth, how it presents, and how people do.
And the treatment, and most specifically, the treatments for those types of cancer are completely different. The good news is that we're developing a wide variety of targeted therapies that are having a dramatic impact in the prognosis and lifespan of those folks. So that is a rapidly evolving area in cancer research, and the news is almost all good.
but smoking's still the dominant thing, and secondhand smoking a big deal.
Absolutely.
And if I can add one more thing, I think we were talking about lung cancer screening and people who have a smoking history being eligible for that. I think the national data that I read show that less than 10% of eligible individuals actually receive lung cancer screening. So lung cancer screening is not doing well, and we really need to encourage people to do that.
We sort of, now you guys know more about this than I do, but are we still quantifying in kind of pack years, how many packs per day you smoke for how long? And the problem is that it doesn't take a lot of pack years in order to qualify you as being at high risk.
That's right. So actually, people have worked out there's an actual formula in terms of your risk for lung cancer, and it involves the number of cigarettes you smoke and the length of time from when you started smoking to when you stopped or you're currently smoking. And it turns out that the most important factor is the length of time. You're not out of the woods, even if you're an occasional smoker.
And can we just say to all those vapors out there, don't think you're safe just because you vape.
That's right.
Talk a little bit about that too.
We are blessed with having one of the world's, greatest researchers here around vaping. Dr. Matthias Salate, who wears a number of hats.
He does. Chair of Medicine, Vice Chancellor of Research, assisting for a good friend of ours and good friend of mine. I've known him for years, but he is a brilliant guy.
Yes, and there are a whole host of complications that are beginning to be manifested by people who engage in vaping, both short-term and long-term. So it is not a habit that is without consequence, that's for sure.
You're getting your partial wish. We have posted Bench to Bedside in our comments. So I just want everyone to know if they want to hear all things Roy Jensen and Bench to Bedside and all the conversations that we're having today, you can go on our comments here on Facebook and click to that link. So, and we are getting some great questions. And I know we're going to be running out of time. I just want to make sure that we're getting to all the questions for our cancer docs today. So Peg wants to know, at what age should men be getting PSA testing?
I'll start with that. So,
what is PSA testing?
changing,
I don't.
doesn't it?
I'm going to ask for my audience here, who is a lot like me. What does PSA mean?
PSA is a blood test. That's the primary way to screen for prostate cancer, and so there are different guidelines that apply to different ages. But in general, men 50 and above should probably start getting a PSA test on an annual basis, and that's done with their primary care doctor. And for people who have a very strong family history, if your father had prostate cancer, if your grandfather had prostate cancer, that age goes a little bit earlier to 45 or even 40. But for regular men, I think 50 is usually the starting age.
So Jess, I have prostate cancer. It's the prostatic specific antigen, PSA, and I started getting it tested when I was 40 because my brother had it, my grandfather had it, and fortunately, it gets classified differently, and I'm in this very good risk category where you should be able to be followed for very many years and not die from it. But you do want to get followed. You do want to see really good folks, and we have some amazing prostate cancer folks here at KU, and it's one of the focuses, and it's actually Dr. Chen is one of those amazing people. So I think it's one of those things you want to get early because it's eminently treatable, and you don't want to get it late. Or find out late, so don't delay. It's another one of those things that if you delay, you can miss your opportunity to make sure that you have a normal life expectancy. Don't do that.
Thanks for sharing that. So do you have to continue?
The other thing to emphasize, just to tag along with what Dr. Stites said, is that when we're screening for cancer, when the cancer is diagnosed at an early stage, there is no symptom. You want to diagnose the cancer when there's no symptom. You want to diagnose the prostate cancer, the breast cancer, when lung cancer, before you feel any problems from the cancer. And so I think a lot of men and maybe women say, look, I feel just fine. Why do I need a test? It's because you want to catch the cancer before it causes symptoms.
And Roy, prostate cancer on the rise. We know it's a big problem for men. Talk about some of the great work our urology team's done and some of those great docs.
Well, we truly have a superb urology department, and in fact, just a few years ago, Brant Thrasher was the president of the AUA. So
yeah, now he's the CEO of that organization.
So we have some very high quality urologists here who do a fantastic job. And you know, the great thing about them is that they embrace a multidisciplinary approach to this disease. And so Dr. Chen, Radiation Oncology, Dr. Parikh in Medical Oncology, they really work together to make sure that the full range of treatment options are available to our patients, and they understand the implications and the consequences of those treatments and the likelihood that they'll benefit you. So there really is not a better group anywhere out there, and I'm talking not just locally but nationally, in terms of the quality of our urologic oncology.
Will Parker here, who now helps run the surgical
awesome.
side, he is amazing. That's my guy, and that's a great team.
And you're doing well.
I'm doing great. Yeah. I'm still out here causing a lot of trouble
That's
for
what I
Roy
was gonna
Jensen.
say.
It's the best.
Doesn't seem to have slowed you down or kept you quiet. or
I've had it
anything.
for like 4 or 5 years. I've been doing fine.
Good. We're glad you're good. Okay, so Christy wants to know, should I be screened since both parents died of lung cancer? They each had a different type of lung cancer. They were long-term smokers but had stopped years before diagnosis.
So stopping smoking decreases your chance, and it slowly goes down, but it never really goes back totally to normal. And so that's something that you need to understand. But the most important thing you need to understand from that is stop as quick as you can. So I'm not clear if this questioner is a smoker or not, but there are very few lung cancer cases that are inherited. Maybe in Li-Fraumeni syndrome, but like we said earlier, 85% of all lung cancers are due to tobacco abuse. So unless you're a smoker, it's unlikely that you would qualify for lung cancer screening.
I'm going to give the last question to you.
Okay, go for it.
This is for one of your fans.
I don't think I have a lot of fans. I'm not sure about
It's
fans.
not your mom. And
Yeah,
you-
I know Hawkeye's mom and dad. I've
It's
got my
definitely
cup
not
today.
any
Got
of
the
the
cup.
Hawkeye.
I know.
I'm bringing it
Jeez.
tomorrow.
So, and I won't even use names,
Okay.
but I'm going to say Dr. Stites is so famous for saying that masks work. I even got the quotes. Masks
They
work.
do work.
What would you say to those who say if masks work, why is vaccination being forced on hospital employees? Wouldn't patients have faith that masks work so that they would not need to be afraid of unvaccinated employees?
Yeah, that's a great question, actually. But here's the answer. The answer is that you want to eliminate every risk.
Yep.
And masks work when they're on, but sometimes people take off their masks and you can still spread it. And so the second thing is we want to keep our entire public safe, right? We want to make sure we can take care of every patient who ever comes here. So when our employees leave here, they may not wear the mask all the time. We know that to be true. And that's where they tend to get COVID-19, and then they can't come to work, and then we can't take care of as many patients. Remember, hospitals are still pretty overwhelmed. We're only taking about a third of the number of transfer patients we used to take. And why does that impact you? Because if you're in a small town and you need to seek a higher level of care, or if you're in any place you need to seek a higher level of care, if the main hospitals in Kansas City aren't able to take those patients, and we're amongst those obviously, especially for time-critical diagnosis like heart attack and stroke and sepsis, infections, etc. If trauma, if you're too full to take those patients, either because A, you have too many COVID people, or B, your staff are out with COVID, then you can't take care of patients who are sick, and that's what we're here to do. So we want our staff to get vaccinated because we realize that they live in the community and they go home and they do all the normal things we all do. And not everybody's always great about wearing the mask when they're not in the hospital. So the reality is we need to keep our staff safe so we're ready to take care of you. And if we can't be ready to take care of you, then we're not doing the right thing. So I think I related the story the other day from a cancer patient getting chemotherapy down at the cancer center and said, yes, the person is masked, but sometimes they take it off, and that Delta variant, it can spread so rapidly. I just want to know that all your staff are vaccinated so that I feel safer. And I think a patient has a right to know that.
Yeah,
I really absolutely believe that to be true. And so I think there are plenty of great reasons that everybody should get vaccinated, and I do think in healthcare it should be a mandate, because otherwise we can't take care of all the sick folks in this city, not just COVID, but all types of diseases. And we know that's been a pressing problem for us.
Yeah, I think also we do not want to be hypocrites. most important thing that we can do to prevent spread of COVID in the community is to get ourselves vaccinated. And if we do anything other than follow that tenet, then we're not being honest with our patients, and we're not living our truth in terms of trying to prevent the spread of this disease, whether it's in our own institution or out in the community.
And we don't, and frankly, I don't want to wear a mask forever, and I want to be able to go gather indoors. And the only way to do that is to get 90% or 85%, whatever Fauci's saying, 85 to 90% of the population vaccinated, and that way we can get a little bit more back to normal, indoors and outdoors. We know outdoors are pretty safe. Indoors, not so much. I want the kids to not have to wear masks in schools. This is not hard. You want to get better, you want to get back to normal, you got to get vaccinated, because it's not going to happen unless you do.
Quick question from Peg. Is there any screenings for brain cancer, and is that hereditary? Dr. Chen?
Yeah. As far as I know, there's no recommendation for brain cancer screening at this point for any patient, even those with a family history.
Okay. Thank you. I had to squeeze in all of our questions from folks, so I will get to the rest of those tomorrow, because you're back.
I'm back tomorrow. I'm back here to cause trouble. Yickety yak's back.
All right.
Yickety yak's back.
Let's get to our final thoughts. Dr. Jensen, let's start with you.
Well, I think we've had this conversation multiple times today, but it's all about getting vaccinated. And not only to protect yourself, but to protect our vulnerable patients, particularly those that have immune compromise, either due to their therapy or whatever situation they're in. And there can be no important message coming out of our program this morning.
Dr. Chen, your parting words today?
Yeah, I wanted a couple of things. One, I want to follow up on a prior question about lung cancer screening and secondhand smoke. So there is no current recommendation for lung cancer screening for people who are just exposed to secondhand smoke but did not smoke themselves. I want to clarify that point from earlier. The other thing is about cancer screening. Cancer screening is really important. We've talked about this here a couple of times. And I think I'm really glad that we're able to partner with some of the local organizations to increase awareness of cancer and cancer screening. So tonight at the Royals game is a game that will increase awareness of breast cancer. I think that's really great. Next weekend's Chiefs game against the Bills will be also a crucial catch that will highlight cancer screening. I'm really glad that we're getting the word out, and we need everybody's help to try to catch up on the cancer screening that were missed last year.
Thanks so much for telling us about those two great events, Dr. Chen, and thanks for being here. Dr. Hawkinson, your final thoughts.
Yeah, it's simple. If you are thinking about getting pregnant, if you are pregnant, if you are alive, if you are over 12, please go get vaccinated. This is going to help reduce your risk of long haul syndrome, of missing work, of coming to the hospital and going to the ICU. So again, continue to endorse and give that message of vaccination. It is extremely safe, and the benefits are much, much greater than any adverse events that can happen.
All right. Oh, and you.
No,
Yes,
thank you. The
Dr.
Center for, I'm just
Stites.
going to read right out of the Washington Post.
Wow.
The Centers for Disease Control and Prevention has issued a call for urgent action to increase coronavirus vaccinations amongst people who are pregnant. The health body said immunization rates amongst that population have lagged as COVID-linked deaths among pregnant people reached their highest levels yet. In the health advisory released Wednesday, the CDC said it recommends coronavirus vaccine before or during pregnancy because the benefits of vaccination outweigh known and potential risks. It said its advice applies to people who are pregnant, recently pregnant, or trying to become pregnant, or might become pregnant in the future. I think that applies to everybody. And you know what? It does apply to everybody, because the reality is, whether you're pregnant or not pregnant, you ought to get vaccinated. I don't want to wear a mask forever. I know we talk about wearing masks all the time because it's the right thing to do, but it doesn't have to be if people will make another right choice.
Pretty clear. Thank you. Thanks to all of our guests today, and thanks for being with us. I said it. Dr. Stites will be back here joining us to answer some questions we did not get to today. Some really good ones, so be ready for those. But before we head out today, I wanted to share some news that Dr. Stites already told about.
Oh,
beginning.
sorry.
You blew it. No, I'm kidding. No, I'm glad you brought it up, because now you can kind of help me out with this, because we're going to show some cool video here. But this is an outstanding accomplishment by our nursing staff here at the hospital, and of course during a pandemic, no less. Yesterday, the University of Kansas Health System officially learned that it was redesignated as a magnet hospital for the 4th consecutive time. Magnet, if you did not know, it stands for attracting the very best of the best in nurses who provide outstanding patient care and leadership, which is, this is reassessed every 4 years, and we have, again, done this 4 times in a row. Only 10% of hospitals in the U.S. achieve magnet status, and only 2%, actually less than 2%, have achieved it 4 times or more in the row. So that just puts it into perspective. This was a huge deal. We could not be more proud of our nursing staff. I know Dr. Stites, you spoke yesterday. I know you are proud of this group of nurses. We just wanted to brag a little bit about our organization, and I'm going to let you have the parting words and your message to our nurses.
This is just the best. Look, here's the deal. I said yesterday, I'll say it again. I work with the best nurse in the world. And Joyce Funks does an amazing job taking care of our CF patients. And at KU, we have a whole lot of best nurses in the world, and it makes all the difference. You know, we can all write the orders. Physicians, we come and go. We kind of drop in and leave. The people who make sure that that care happens and really provide the best quality of care at the bedside and make the biggest difference in how patients do are our nursing staff. They're outstanding. I wore green today in that honor. They are amazing people, and it's why you get the best care in the world right here at the University of Kansas. I know I sound like a homer. I try not to do that, but it's true.
It is true. I will end on that. Everyone have a great day. We'll see you tomorrow at 8.
And I'm thrilled to let you know that we're designating the University of Kansas Hospital as a magnet hospital.
None of this happens without everybody in this room and everybody who works in our hospital every day.
I'm so proud of everybody in this room. You guys do amazing work.
The commission unanimously voted to credential University of Kansas Hospital as a magnet organization again.
The Commission on Magnet has unanimously voted to credential the University of Kansas Health System as a magnet organization. This is your 4th designation. Congratulations, colleagues.
Subscribe to our morning medical update and open mics with Dr. Stites podcasts. Now everywhere podcasts are available.